Join Stella Academy, Goa's best coaching for IIT, JEE and medical exam preparation. Register today for Stellar Talent Search exam. Admissions are open for repeaters medical batch for NEET 2021.
Now, in this entire exercise, we'll test our cold chain facility, our transportation facility, our manpower facility, vaccinators, and then syringes, etc. Whatever is the biomedical waste generated, that how it's going to be handled. So entire exercise will be done in a dummy manner. Now, the supervision at all levels is being done, at the PHC level, at the district level, at the state level, and the entire exercise is being monitored by the experts of UNDP. After the exercise is over, a review will be done by the seniors, and then debriefing will be taken and the report will be submitted to the government of India.
Beneficiary will come inside. The names are already registered on the app. Whoever registers only will be given the vaccination. Once he verifies, then for authentication, we have got a data entry operator who will enter all the details on the laptop, that is a portal. Once this process is over, the beneficiary goes in the next room. This vaccination room, only one beneficiary will be allowed at a time and one vaccinator, that is the sister will be there. This is our observation room where there is a provision for beneficiaries to sit. After receiving the vaccine, the beneficiaries will sit here for half an hour to see if there are any side effects occurring of the vaccine. In case if the beneficiary gets any side effects, untoward event, we have got all the facility to tackle it. One medical officer round the clock and one sister with all the facilities. Once the half an hour is over and if the beneficiary has no side effect, beneficiary will pass to the separate exit room to his home.
Shortlisted 25 health staff, but this will happen overall in a phased manner. So all the areas under primary health center jurisdictions would be covered up. Initially, in the first phase, all registration will be taking place of all the patients. Once the registrations are proposed, in a batch wise, sub-center wise, आमचे under 7 sub-centers असतात. So area wise, senior citizens, comorbid patients, कोणाक diabetes असतात, कोणाक hypertension असतात, those patients will be taken care of.